There's a quote by Sadhguru: "Once you have let your past decide how you should experience the present, then you have destroyed your future." In psychodynamic therapy, the idea is that our early experiences and the lessons that we learn, especially as a child, dictate how we experience our present moment. Like, for example, if you were a child where mom would always kind of tell you messages of like you're being a bother or you're not good enough, that this is going to manifest in many different ways in the present moment. Like, for example, if you are talking with someone, you might have the thought, I'm probably bothering this person, or you might shorten how long you're talking to somebody because you worry that you are taking up too much of their time. So you're allowing these past lessons of you being a bother dictate how you experience the present moment, which of course significantly impacts your future. So many of us carry the same shame and guilt that have developed as a result of these past experiences and bring them into the present moment. And my goal as a therapist is to highlight these links and find a way for us to break the chains that tether us to the past and keep us feeling stuck, ashamed, guilty, and be able to carry on in the present moment in a way that is much more effective and adaptive and helpful. So in this video, I'm going to talk about some of the strategies that I use with my patients to help them break away from these chains of the past, help them feel less ashamed and less guilty, and help them make sense and reconcile with their past so they can have the sort of liberty to choose their own future and experience the present moment a little bit more for how it is. So one of the ways for us to reduce a sense of shame and feeling that we are bad people is do something called self-compassion. Now, I know what you're thinking. Like, most people talk about self-compassion, it's much easier said than done. We're often our own worst enemies when it comes to being very self-critical and not very self-compassionate. So one thing that I'll talk to you about is what are ways that we can increase our sense of self-compassion. So one way to increase self-compassion is to ask yourself the question, what about my behaviors made sense at the time? Like, for example, when you were a young child and you were being scolded by your parents, maybe your reaction at that time was to go into fawn mode and to kind of hide away and disassociate. And that was a way to protect yourself because at the time, as a young child, you weren't able to resolve the issue outside and you weren't getting any support and love from your family. And as a result, the only thing that could have been done as a 10-year-old child, for example, would be to kind of hide away and do nothing. So that behavior at the time made a lot of sense for what was going on at the time, even if right now in the present moment, it's no longer serving the same function. So one of my patients had a history of people yelling at her and calling her stupid. And in her sort of defense at the time, her defense was to get really, really angry and shout back and yell back because she realized by putting on this sort of strong armor and suit that other people wouldn't bother her anymore. So at the time, her anger and her outburst made so much sense because it was a way to protect herself from shame and guilt and all these kind of hard emotions and people attacking her and criticizing her, even though right now her anger actually now negatively impacts her interpersonal relationships, that it made a lot of sense at the time. So being able to validate and say, hey, it made a lot of sense that back then that was my behavior because it was a way for me to protect myself. And to really shore up the self-compassion side, the other way that can be really helpful is to ask yourself, hey, if this was my best friend in the same situation, or if I were talking to the child version of me right now, what would I say to them? And the reason why this is really helpful is because we're often very self-critical, but we tend to be quite compassionate towards other people, like our best friend or like the child version of ourselves. And we can kind of come up with these more gentle, compassionate, while maintaining accuracy statements to be able to reduce shame and guilt. And the reason why self-compassion is so helpful is because it allows us to reduce shame and guilt. And the reason why that is important is because shame and guilt tells us that we did something wrong and that we are bad people. And the action urge associated with shame and guilt is to withdraw and do nothing and feel even worse about ourselves. So by giving us that self-compassion, we can look at reality with a new lens and be able to act more effectively given the actual facts of the situation and take the off-ramp from the things that used to serve us, but maybe no longer serve us very well now, and be able to choose a different response so that we can really have the freedom to dictate our future. So after giving yourself a little bit of self-compassion, another strategy that can be really helpful, or a set of strategies, is start being able to process and deal with these unhelpful emotions. And one strategy to be able to do so is something called opposite action, otherwise known as opposite to emotion action. And the idea behind opposite action is to be able to engage opposite to what an emotion is telling us. So if we're kind of feeling a sense of shame associated with something that happened in the past, the shame is going to tell us to hide away and to do nothing and to feel worse and worse about ourselves. So one thing that we can do opposite to what the emotion is telling us to do is to open our bodies and open our hands up a little bit more and to be able to engage in our value-based behaviors anyway. So instead of kind of hiding in our house, maybe we decide to go outside despite feeling that shame and connect with other people and hang out with a friend or do things that we find really a lot of meaning and joy in. Maybe we'll get back into our hobbies and play on the piano, whatever that might be for you, to do what the sort of anxiety or the shame is telling us to do and do the opposite of that by getting out into the world and living our valued lives. Another way to process and sit with these kind of uncomfortable feelings, because oftentimes when we think about trauma, we actually tend to kind of avoid the uncomfortable and unpleasant thoughts and feelings. We try to maybe scroll on TikTok or social media or YouTube shorts, or we tend to distract ourselves with other things, but we never allow ourselves to really sit and process with the crap that we've been dealing with. So one thing that we can do is actually to take sort of 10-15 minutes on a little journal and write down how you felt about a certain situation, allow the emotions and thoughts to flow onto the page, and give yourself a way to process the stuff that comes up and be like, oh, I'm noticing that these sensations and feelings and physical sensations are popping up. And is there a way I can, even for just another moment, to sit with them, allow them to be just as it is, and relate to them a little bit differently? And this may not work for everybody, but sometimes it can be helpful to make sense of our past by understanding the person it has made us today. So I'll tell you about a story about one of my patients who dealt with a significant trauma that happened in her past. And for the longest time, she felt this sense of responsibility and guilt and shame associated with it, and how it significantly impacted the course of her life. And during our treatment and therapy together, she had made a lot of progress. And one way that she reconciled this sort of horrible thing that happened to her was how it changed the way that she behaved today, in that now she was volunteering and doing a lot of work in that same space and supporting other people who went through a similar trauma. So she had taken something that was really terrible and horrible that happened in her past and turned it into this sort of resilience and strength and a sense of purpose to support other people going through the same thing. So I would wonder if there's a way that we can reconcile the past by understanding how it has in some ways positively influenced you in the present moment. Maybe it's made you sort of much more wiser in your own values and philosophies. Maybe it's made you highly empathetic towards other people in a similar situation. Maybe it's allowed you to cultivate some sort of awareness of an issue that now you're trying to solve. Something about it that has allowed you to become a better person. Is there any way to offer yourself that grace? If not, and that doesn't feel comfortable, that's totally okay. And you can grieve for the crap that has happened to you. And if there is a way for you to make sense of the past and find meaning in the present moment, then that could be one way to resolve some of the guilt and shame associated with the situation. And one final strategy that sounds a little bit strange is to ask the question, whose voice is this? And the reason why this is helpful is because oftentimes past traumas lead to a self-criticism that isn't actually from our own selves. It's actually from someone else saying these things that we've now internalized. So I'll tell you a story about a patient who had all this self-criticism every time that she didn't finish something that was like home practice, or she didn't do very well on an assignment. She would have this sort of very strong critical thought of like, you're stupid, you're dumb, you don't know what you're doing. And one thing she realized over our time in therapy together was that it wasn't really her voice that was saying all those things. She was remembering, and in some ways her trauma network was being activated by mom saying all of those things to her every time that she didn't do something perfectly. So by asking the question, whose voice is this? She was able to recognize it wasn't actually her voice that was saying all these terrible things. It was her mom's voice, and creating that separation of like, oh, like this is my trauma network being activated. It was someone else who had told me all these things when I was young, allowed her to create a sense of emotional and psychological distance from the self-criticism or criticism in general, and be able to allow for space in between the two and improve her own well-being at the time. So I hope some of these strategies were helpful for you to more flexibly navigate when these more harder feelings come up, and they inevitably will. Our past will rear its ugly heads from time to time, but hopefully this gives you a sort of collection of both acceptance-based strategies of sitting with and allowing, as well as change strategies of kind of ways of processing to be able to kind of move you closer to the future that you want to get to. Thanks for watching. I hope you enjoyed the video, and I wish you a wonderful week. Bye-bye.